I know that's an area you help people with, but frozen shoulder, firstly, what is frozen shoulder? And then we'll get into how you can help people.
So basically, frozen shoulder, you can sort of divide it into three parts really. The first part of the frozen shoulder was where it's really inflamed, the capsule around the joint. The other name for frozen shoulder is adhesive capsulitis. So adhesive meaning it sticks to anything very quickly and for quite a long time. And itis, capsule, means the capsule around the joint, and itis meaning inflammation. So it means sticky inflammation of the joint, of the tissue wrapping around the joint. So when that does get inflamed and when it does become sticky, it doesn't allow any form of movement. Okay. Movement becomes very, very painful, and they almost become disabled in that arm. So that lasts for about 6 months generally, and they call that the freezing part of frozen shoulder. The next part is the frozen part, where it becomes incredibly stiff. The inflammation is not as bad as it used to be, but their range of motion is virtually zero, so they're only getting 10 or 20 degrees in any direction, and it's just very stiff. And that again lasts for about 6 to 7 months. Right. And then you've got the final bit, which is they call thawing, which is where you start to gain a little bit of range of motion, but the stiffness is still there. So it's a long old process, and it's not very comfortable. And one of the reasons I treat it is because I think it's one of those more rewarding type of things. If you can get results with it, people are quite grateful, and it makes me feel good as well. So.
Sure. And what's the treatment plan look like?
My treatment tends to be more deep soft tissue work, and this is especially for the freezing part, the first part where there's a lot of inflammation. The more you try to move the joint, the more you'll affect the capsule, and the more the body will try to protect itself. So I keep the arm in a comfortable position, normally lying on the opposite side, and I do a lot of deep soft tissue trigger point work, which is quite painful. The other part of it then, once they start to get a little bit more less pain and it's a little bit less inflamed, I then try to incorporate some more movement-related sort of treatments, so stretching, but very, very gentle. I see how far they can go, and I just try to take it a little bit further. And I start to give them exercises to do at home, and then that sort of progresses through the different stages and beyond.
So again, it kind of starts with you doing the hands-on stuff, but then it's all about the patient doing the exercises and...
Compliance is key.